Hello, hello, hello. Welcome to Two Everyday Assholes. Once again. Oh, was I supposed to say that? Well, hey,
Oh well,
that's what the
hopefully we'll
podcast
get over it.
is. Oh, yeah, of course, because this is made for adults. And we kind of stumbling. I'm William. All right, all the way. Kind of stumbling around, and the podcast is basically random topics. So I mean, like, and there are topics that we specifically relate to things that's going on in the world today. So we're not going to miss like with what we're going to talk about. So what it basically, and man, this guy can chop it up on just about anything concerning the system and the world and the way things are. But today it's a hard one, kind of hard one to dig into. But we're gonna see what we can get out of it. And y'all are welcome to make comments, leave comments. Hey, share your opinion, your view concerning it. We'll be glad to uh, receive it, check it out. Hopefully, we might be able to learn something. Like I said, we're just two everyday just
Assholes.
yeah, just trying to make our way through the world like everybody else. So I hope all is well all the way. And from me to God and our Lord and Savior Jesus be all glory. I pray that y'all are okay. But anyway, our topic today is about healthcare.
What about it?
Dog,
Why is it so expensive?
yeah, yeah, yeah. This the whooping that is putting on American citizens is tearing it up.
I wouldn't know. I can't afford it. So
Right, yeah, exactly.
I don't know. I did a little bit of research,
Hmm.
just kind of looking to see what was going on with some of these insurance companies,
Oh,
things like
right,
that.
right. Okay.
The Obamacare stuff was hilarious.
Hmm.
There are people that literally admit they don't know how it worked, how it was going to work, and they proved it anyway. So I kind of got tired of looking at that because I'm not really a big Obama fan anyway. I'm not a big president period fan. They're all suck.
That's something me and you both can agree
Yeah.
on. That
So I kind of looked around a little bit at
I got a guy.
insurance, just to,
Amen.
yeah. I looked around a little bit on some insurance sites and was just trying to get an idea. And I found a website, Jacobin.com,
Okay.
and it listed the top three insurance companies by their corporate names anyway,
Hmm.
and the amount of declines and lawsuits and everything they were going through. The biggest one in the country, of course, is United Healthcare. I think everybody's heard of that one. I had them when I actually had Obamacare when it first started. And a couple months in, they sent me a letter saying, "Hey, we're dropping Obamacare because we can't make any money," which is probably a lie. I don't know, but
Right.
it really sucked after that. But anyway, United Healthcare Group, they declined roughly about 10% all their claims, and that's like I said, Jacobin.com. It was an article from June 10th of last year, 2025. And even though it said they declined 10%, one of the things that really kind of caught my eye, this company makes a huge amount of profits, and the stockholders were literally suing the insurer, trying to stop it from approving any more patient care. They thought that 10% wasn't high enough in decline. Yeah. The next one, I had to ask Jim and I for some info because I couldn't find anything. Yeah, billions just aren't enough. Uh, Elevance was one of the bigger companies. It
Mm.
said some reports claim they deny up to about 4 out of 5 claims. 80%, that's pretty lousy.
Yeah.
Several key disputes involved GLP-1 meds, mental health issues, and ghost networks, leading to, in some cases, federal and class action lawsuits. I'm surprised they're still in business, to be honest with
Exactly. They're pulling some switches some other kind of way.
you. Yeah. The last one was CVS, a company called CVS, not the
Not
pharma
the
group,
pharmacy.
but the med insurance company. It's Gemini again. It faced significant legal scrutiny and multi-million-dollar settlements regarding improper claim handling, allegations of over-dispensing medication, using AI, which is a problem with all of them now, to improperly deny Medicare Advantage claims, and
Mm.
overbilling payment government programs. Imagine that. Uh, Recent reports highlighted improper denials for post-acute care for issues with pharmacy benefit management.
Y'all better play this stuff back. Listen, for real. listen, listen. He's going through it, right? I understand it because I studied on it. I studied up on some of the stuff, and I've had to deal with some healthcare big time in the past 4 years. But this, what he's saying, if you think this is not going to affect you, you're insane. You are insane. If you think this, oh, it don't have nothing to do with me. Oh, yes, it do. You live in the United States.
One of the things
You
I
do.
did I couldn't understand, I think it was it might have been
I can't remember. They were getting class action lawsuits for denying insulin shots. I mean, not shots, but insulin.
Mhm.
Could somebody help me understand how I can lay in the street basically in any major city in this country, overdose on heroin, and
Oh,
I get free Narcan?
yes. Pass it
but
out.
if I need something like
Insulin.
insulin
Ooh.
or what is the thing that you use to make an allergic reaction?
Hmm.
I can't
I
remember.
know what you're talking about. Yeah, the emergency thing.
Yeah, I can't remember that. But anyway, you have
People
to
out
pay
here know.
hundreds of
Yes.
dollars for that.
Yes.
But I can go overdose out there on the street and I get Narcan for free. You know, you ever seen if you have a problem with pain pills at your home, which
I mean, you get prescribed pain pills and you accidentally OD in your house, the ambulance has to come and get you. I bet you have to pay for your
oh
Narcan.
yes,
But
oh yes,
it just
it'll
amazes
be
the
on my
hell out of
bill.
me.
Trust me, it will be on
Yeah,
my bill.
it just amazes me how we treat the illegals coming into this country for free. That's one of the things I don't understand. According to what Obama did to our medical system, I have to have medical insurance, or the IRS is supposed to fine me $600 a year, I believe it is.
That's right. That's right.
Yet every legal coming into this country gets it for free if they come in through California, New
Bro,
Mexico,
listen,
blue
I'll tell
states.
you, you tell me.
You explain that to me, you win all the marbles. Yeah, here you go. You
Well,
just take mine.
I have an idea. You and I denounce our citizenship.
Oh,
We'll cross the Mexican border illegally, and we'll come back as illegal.
And then that way we get free housing, free
It'll
medical,
be,
good shape.
yeah, I mean, that was the only thing I could think of.
to make this actually work right. I mean, my God, between the two of us, hell, we've got 50 plus, well, actually
Oh,
over 60
yeah,
years of working
yeah,
and have nothing to show for it, except we get to pay for all this crap
yes,
coming across our border. I
yes,
mean, it's just one damn thing after another. I'm sorry.
yeah. And
Uh,
this guy thinks
he's not. We're not gonna get a lot of comments. This topic alone, this discussion alone,
the comments ought to be,
because it's not. You listen. If you live in the United States, it's not. It's not like I have to be. I have to be honest with you. For a long time, and then particularly because I lived a certain kind of way. But for a long time, I consider all this stuff not my business. Okay. Then I got a child. Then I got jobs. Then I got sick and had to go to hospital and doctors. And you get a awakening of what's going on in the system and this kind of stuff, these kind of things. And people perish for lack of wisdom. So it ain't about like you getting ready to these two guys right here to get ready to tell you, explain and break it out. No, we're not newscasters. We're not none of that. We're not no geniuses and all this stuff right there. We're just just what this thing says. The podcast says, the title of our podcast says. But we have a lot of common sense.
Yeah, you'll have to forgive me. I'm a little tired and cranky.
That's all good.
But
I know this guy has a lot of common sense. I know I have a lot of common sense, and it's just
well,
common
it's
sense.
it's it's not even common sense. It's stupidity on our part because we allow it to happen.
Right.
But
Exactly.
what we allow the government to do to us is just freaking ridiculous. One of
When
the
I say common sense, I mean we got enough sense to be aware of it.
yeah,
You understand what I'm
well,
saying?
most
Like
people
what?
do, but a lot of people just won't do anything. It's ridiculous.
we are.
But I mean, there's a pharmacist that went on Joe Rogan's program, and he was using an example of a certain medication where he said it would cost him $2, and he would turn around if somebody paid cash, he'd sell it for $4. But if you have medical insurance,
Mhm.
this is the catch. It's in the law that says he can't tell you it would be cheaper for you to buy it paying cash than with your insurance. So if you show your insurance card before asking the price, he has to put on your insurance, right? He said now that medication that would have cost you $4 is going to cost you $10 for your copayment. Okay. Now the insurance company demands a $7 kickback off of that. So now the pharmacist only makes $3 off of it, where he'd only make 4, and the insurance company makes $7
All right.
off one. And that's just one example. There's a lot of you'd have to look around on social media. There's a pharmacy. I can't remember the guy's name because it's been so long since I've seen him. This guy literally sets his prices to where he makes $10 off of everything practically. That's it. He doesn't take medical insurance. Nothing. If you were to go and buy chemotherapy, we'll say you had to have certain drugs. If you paid with that, if your insurance would actually cover it, it would be ridiculous. Most people would probably end up on some kind of welfare program because it's just too damn expensive.
Most people do.
Yeah, but you could buy this stuff from this guy for like $25 a month. I mean, it's ridiculous.
Numbers, man.
Mhm.
Numbers. I had some, I believe it was 2020, and I had been involved in this big study concerning pharmaceutical companies. And I'm sitting up here at this time, a $9 an hour working man, and I'm looking at the bull that these people are running to make billions. And some part of you go like, I'm in the wrong business. That's some part of, but at the same time, say, now this is just me. I'm being me. William, I don't want I don't want something that's harmful to other people. I'm good on that.
Well, that pretty much cuts out most medications.
Right. Right, exactly. I'm good on that. Nevertheless, it's a struggle to watch. It's a struggle to watch. Bull make all that money, and you sit up here struggle to make a car payment. It plays on you. It plays on you if you let it. And I try not to let it. I always tell people, with the way things are in this system now, you can either be, you're going to be affected because you live in the United States. If you live in the United States,
It's not even just that. I mean,
but you don't have to be.
look what we've done to the elderly. I mean, you have some
Oh,
people that are
goodness.
barely getting down left and right, and all of a sudden they come up with something that's going to kill them if they don't take care of it. Now they have to decide, do I pay the property taxes or do I lose my house? Do I get
That's
to
crazy.
eat this week
That's
or
crazy.
do I pay for my medication
That's
and my
crazy.
medical care? There is no damn reason a country this size that's supposedly supposed to be rich, even though we're $40 trillion debt supposedly.
And when did they start paying FICA? The minute they started working.
Mhm.
And some of these people have worked 30 plus years.
Well, there's another good example of that. You can start working certain jobs when you're 15. Most you have to be 16,
Mm.
right? You can't start voting until you're 18 years old.
Uh,
So if you're working at 15 years old and you're paying taxes, isn't that taxation without representation? Didn't we go to war for this crap?
yeah,
Okay, I'm just making sure.
yeah, yeah, yeah. But that's the
Just another damn thing, right?
that's it. It's one more topic for y'all to comment on. One more thing, y'all kick back, kick back. Listen, uh, we tell you about stuff we know. We want to know about what you know. Help us.
Help us help others.
Yeah.
Hell, even if all you do is tell us to shut up, at least we got to come.
That's it. Thank you. Yeah. I don't. To me, I don't see us as being desperate for comments. I know what goes and what can go, and I know what people are having to do with this. I understand. Listen, it will. You will eventually have a great following, and people gonna be attracted to this because guess what? We're two everyday assholes, but guess what? People understand where we're coming from with that. Because it's high time. See, you hear a lot of stuff, political stuff from these newscasters and very highly educated people and people that study and they have all these big titles and they're just stuff behind the name. Guess what? I'm William. This Brian.
Something to end on. Just remember, you go to your pharmacist, always ask for a generic and always ask the cash price before you show them your insurance card. You may save some money.
That's a good info.
Oh, guys, enjoy your weekend.
Yes, sir. All the way.